Our lecture in Advanced Biology is the application of saliva as a diagnostic fluid. The salivary gland in mammals are exocrine glands with ducts that produce saliva. In general, healthy adults produce about 500 to 1,500 mol of saliva per day at a rate of approximately 0.5 mol in minute. There are three major salivary glands, which are parotid, submandibular, and sublingual major salivary gland, and numerous minor salivary glands. Human saliva is not just the fluid in our mouth, but it mirrors our body health and well-being. Biomolecules that are circulating in the blood are also found in human saliva. It consists of approximately about 2,000 proteins, and most significant 26% of these proteins are also found in blood. Therefore, emphasize the saliva's importance as an added biological resource for disease diagnosis and monitoring, as well as ultimate diagnostic media to establish a person's response to treatment. The field of saliva diagnostic began in the early 60s when salivary calcium levels were found to be elevated in cystic fibrosis patients, and 55 years on now, how the field has an unpredicted distance due to the development of increasingly sensitive detection technique. Hence, today, in the era of nanotechnology and genomics, field of salivary diagnosis is promoting a dramatic change in disease diagnosis and clinical monitoring. It has expanded into detection of cancer, heart, and infectious diseases. Composition of saliva. Saliva contains 99.5% water and 0.5% solids. These solids include organic substances like enzyme, like amylase enzyme, maltase enzyme, and others. Other organic substances like mucin, albumin, and etc. Also, inorganic substance, which includes sodium, calcium, potassium, and etc., and gases like oxygen, carbon dioxide, and nitrogen. Function of saliva. Function of saliva in teeth for protection, in buffer, protection against demineralization, remineralization, lubrication. Microorganisms. It contains antiviral, antifungal, and antibacterial in food for digestion, taste, and bolus formation. Formation and secretion of saliva. Formation of saliva occurs in two stages. Stage 1, production of primary saliva from the cells of secretory end piece, which is called acini, and intercalated duct, which is an isotonic fluid. Stage 2, the primary saliva is modified as it passes through the striated and excretory ducts, mainly by reabsorption and secretion of electrolytes. The final saliva that reaches the oral cavity is hypotonic. This is the acini, and this is the lumen of acini, and this is intercalated duct, and this is the striated duct. As a diagnostic fluid, saliva offers distinctive advantages over serum because, first, non-invasive diagnosis of disease and monitoring of general health. Second, painless. Patient suffers no discomfort and little anxiety in the collection process. Third, simple in collection with a modest trained assistant and applicable in a remote area. Fourth, relatively cheap technology as compared to other tests. 5, cost-effective applicability for screening large population. 6, can be used to study special population where blood sampling is a problem, example, children, anxious, handicapped, elderly patients. 7. Convenient for multi-sampling. 8. Safer for health professional than blood test. 9. Compared to blood and urine, saliva is also cheaper to store and ship. 10. In addition, saliva does not clot and can be manipulated more easily than blood. Whole saliva. However, whole saliva is most frequently studied when salivary analysis is used for the evaluation of systemic disorders. Whole saliva or mixed saliva is a mixture of oral fluid and includes secretion from both the major and minor salivary glands, in addition to several constituents of non-salivary origin, such as gingival clavicular fluid, expectorated bronchial and nasal secretion, serum and blood derivatives from oral wound, bacteria and bacterial products, viruses and fungi, desquamated epithelial cells, other cellular components, and food debris. Analysis of saliva done for the diagnosis of the following: first, hereditary diseases; second, autoimmune disease; third, malignancy; fourth, infection; 5. Monitoring of level of hormones; 6. Monitoring of level of drugs; 7. Bone turnover marker in saliva; 8. Forensic evidence; 9. Dental caries and periodontal disease; 10. Diagnosis of oral disease with relevance for systemic diseases. First, hereditary diseases. Cystic fibrosis is a genetically transmitted disease of children and young adults, which is considered generalized exocraniopathy, a defective electrolyte transport in epithelial cells and viscous mucus secretion from glands and epithelial characterized this disorder. The organs mostly affected in cystic fibrosis are sweaty gland, lungs, and pancreas. Elevation in electrolytes, sodium, chloride, calcium, and phosphorus, urea and uric acid, total protein, and lipid were observed in the submandibular saliva of cystic fibrotic patient. Most of the studies concerning the diagnosis application of saliva for cystic fibrosis are relatively old, and saliva is not currently used for the diagnosis of this disorder. Second, autoimmune diseases like Sjogren syndrome. Sjogren syndrome is an autoimmune exocraniopathy of unknown etiology. Serum chemistry can be demonstrated polyclonal hypergammaglobulinemia and elevated level of rheumatoid factors, anti-nuclear antibody, anti-Sjogren A, and anti-Sjogren B antibody. In addition, increased concentration of sodium and chloride, IgA, IgG, leucoferrin, and albumin, and decreased concentration of phosphate were reported in saliva of patients with Sjogren syndrome. No single salivary or serum constitute can accurately serve as a diagnostic marker for Sjogren syndrome. The most important aspect of salivary diagnosis for this disease is the reduced salivary flow. Although not pathognomonic for Sjogren syndrome, is of clinical importance and can lead to a variety of oral signs and symptoms, such as a progressive dental caries, fungal infection, oral pain, and dysphagia. Dentists are normally the first to encounter these patients. Affected individuals should be referred for the comprehensive evaluation of the cause for the reduced salivary flow. Third, malignancy. Salivary analysis may aid in the early detection and screening of certain malignant tumors. Saliva also aid in monitoring the efficacy of treatment. The messenger RNA level for specific protein are elevated in the saliva of head and neck cancer patients. P53 is a tumor suppressor protein which is produced in the cell exposed to various types of DNA damaging stress. Inactivation of this suppressor through a mutation is considered a frequent occurrence in the development of human cancer. Accumulation of inactive P53 protein occur, which in turn lead to the production of antibodies directed against this P53 protein. The P53 antibodies can be detected in the saliva of patients diagnosed with the oral squamous cell carcinoma and can thus assist in the early detection and screening for this tumor. Defensin. Elevated levels of salivary defensin 1 were found to be indicative of the presence of oral squamous cell carcinoma. High positive correlation was observed between salivary defensin 1 level and serum level of squamous cell carcinoma related antigen. CA-125 is a tumor marker for cancer. Elevated salivary level of CA-125 were detected in patients with untreated breast cancer than healthy control and patients who were treated for breast cancer. A positive correlation was found between salivary and serum level of CA-125. For infectious diseases, saliva contains IgA, IgM, IgG that originate from two sources, the salivary gland and serum. Antibodies against viruses, bacteria, fungal, and parasites can be detected in saliva. Helicobacterial pylori infection has been associated with peptic ulcer and chronic gastritis. Oral cavity may be the source of infection. There was considerable variation in the detection rate of Helicobacterial pylori DNA in salivary sample. Shigella is in the children infected with Shigella revealed higher titer of anti-Shigella toxin antibody in comparison with the healthy control. Pneumococcal pneumonia. The detection of pneumococcal polysaccharide in saliva by ELISA may offer a valuable complement to conventional diagnosis method for pneumococcal pneumonia. Non-invasive diagnosis of amoebic liver abscess and challenging detection of Escherichia histolytica DNA in saliva by real-time PCR assay could be used as a diagnostic tool for amoebic liver abscess. Viral diseases. Antibody to HIV in whole saliva of infected individual was detected by ELISA and Western blotting assay, correlated with serum antibody level. Salivary IgA level to HIV decline as infected patients become symptomatic. It was suggested that detection of IgA antibody to HIV in saliva may therefore be a prognostic indicator for the progression of HIV infection. Analysis of antibody in saliva as a diagnostic test for HIV or other infections offers several distinctive advantages when compared with serum. First, saliva can be collected non-invasively, which eliminates the risk of infection for the healthcare worker who collect the blood sample. Second, furthermore, viral transmission via saliva is unlikely since infectious virus is rarely isolated from saliva. Third, saliva collection also simplifies the diagnostic process in a special population in whom blood drawing is difficult, i.e. individuals with compromised venous access, example, injected drug users, patients with hemophilia, and children. Hepatitis. Saliva was found to be a useful alternative to serum for the diagnosis of viral hepatitis. Acute hepatitis A and hepatitis B were diagnosed based on the presence of IgM antibodies in saliva. Hepatitis B virus DNA revealed by PCR in saliva, quantitative detection of DNA used to evaluate level of virus in body copy for judgment of infection. It also points to the possible role of saliva as source of HPV infection. Saliva has also been used for the screening for hepatitis B surface antigen in epidemiological studies. Measles, mumps, and rubella. Saliva may also be used for determining immunization and detecting infections with measles, mumps, and rubella. Reactivation of herpes simplex virus type 1 is involved in the pathogenesis of Bell's palsy, and PCR-based identification of virus DNA in saliva is a useful method for the early detection of HSV1 reactivation in patients with Bell's palsy. Dengue is a mosquito-transmitted viral disease. Salivary level of anti-dengue IgM and IgG demonstrated sensitivity of 92% and specificity of 100% in diagnosis of infections. So detection of dengue-specific salivary IgG and IgM antibodies is useful marker for dengue infection. 5. Detection of a drug. Saliva has been proposed for the monitoring of systemic level of a drug. A fundamental prerequisite for this diagnosis application of saliva is a definable relationship between the concentration of therapeutic drug in blood and the concentration in saliva. Only the only the unbound fraction of the drug in serum is available for diffusion into saliva. The unbound fraction of the drug is usually the pharmacologically active fraction. This may represent an advantage of drug monitoring in saliva in comparison with drug monitoring in serum, where both bound and unbound fraction of a drug can be detected. All these drugs are monitoring in saliva. Saliva may be used for the monitoring patient compliance with psychiatric medication. Saliva is also useful for the monitoring of anti-epileptic drug and anti-cancer drug. Estimation of salivary carbamazepine level is a predictable and convenient method of drug monitoring in epileptic patients. Of particular interest is the use of saliva for evaluation of illicit drug use. Following drug use, the appearance of the drug in saliva follows a time course that is similar to that of serum. The presence of illicit drug and not their concentration is usually sufficient for forensic purpose. Ethanol. Salivary ethanol concentration may be used as an index of the blood ethanol concentration, provided that the salivary sample is obtained at least 20 minutes following ingestion. Nicotine. Saliva can be used to monitoring tobacco smoking and exposure to tobacco smoke. The major nicotine metabolic cotinine was investigated as an indicator of exposure to tobacco smoking. Cotinine is tobacco specific and has a relatively long half-life, about 17 hours, compared with nicotine. Salivary cotinine levels were found to be indicative of active and passive smoking. 6. The monitoring of hormone levels. Saliva can be analyzed as part of the evaluation of endocrine function. Cortisol, a steroid hormone, can be detected in saliva. Salivary cortisol levels were found to be useful in identifying patients with Cushing syndrome, Addison disease, and effect of stress. Aldosterone. Recent evidence demonstrates an increased incidence of primary aldosterone in approximately 10% of the hypertensive population, making non-invasive and simple screening method necessary. Salivary aldosterone correlates significantly to plasma aldosterone level, and increased aldosterone level were found in both the serum and saliva of patients with primary aldosteronism or Conn's syndrome. Testosterone hormone have also been identified in saliva. Correlation between the salivary testosterone concentration and the serum free testosterone concentration is better than with total serum testosterone because most of the testosterone in the saliva is in the free form. Progesterone. Salivary progesterone level showed good correlation with free serum level. Elevated salivary progesterone is associated with increased risk of preterm birth. Insulin. Insulin can be detected in saliva. A positive correlation between saliva and serum insulin level following a glucose tolerance test was reported for healthy subject, diabetic patient, but the use of salivary insulin level for the evaluation of serum insulin level could be misleading since significant discrepancies between salivary and serum insulin level were detected for several individuals. Additional studies are required to determine if salivary insulin level should be used for the evaluation of serum insulin level. Saliva also contains multiple components whose concentration are altered by diabetes, some of which, glucose, alpha amylase, and ghrelin, have a strong diagnostic potential. In general, serum and salivary level of protein hormone are not well correlated. These hormones are too large to reach saliva by means of passive diffusion across cell or by ultrafiltration, and the detection of these hormones in saliva is primarily due to the contamination from the serum through gingival clavicular fluid or oral wounds. Protein hormones such as gonadotrophic, prolactin, and thyrotropin cannot be accurately monitored by means of salivary analysis. 7. Bone turnover marker in saliva. Saliva can be used to measure bone turnover. Commercially available ELISA used to test for the presence of osteocalcin and pyrrolidine in the whole human saliva of women. Level of osteocalcin and pyrrolidine in saliva correlate reasonably well with bone mineral density scores, suggesting that saliva may be a valuable tool for assessing a human marker of bone turnover. Further research is necessary to determine whether salivary level of bone turnover marker correlate with serum. 8. Forensic evidence. Saliva may be found on victim of several violent crimes. Saliva can potentially be recovered from bite marks, cigarette butts, postage stamp, envelope, and other objects. Stain of dried saliva are invisible, making its recognition and collection difficult. However, the presence of saliva can be confirmed by amylase assay. During the biting process, saliva is deposited on the skin or object surface in enough amount to allow typing of the deoxyribonucleic acid polymerase chain reaction allow replication of thousands of copies of a specific DNA sequence in vitro, enabling the study of a small amount of DNA. 9. Dental caries and periodontal diseases. A numerous studies find a correlation between dental caries and saliva constituent with only weak correlation. High bacterial aggregation activity of saliva has been associated with low caries experience, since there is a long list of salivary proteins that bind and aggregate oral bacteria, so aggregation couldn't be correlated with a specific salivary protein. Several bacteria have been associated with periodontal disease. These bacteria are susceptible to different antibiotics. Therefore, prior to antibiotic treatment, pathogens should be determined by culturing or PCR technique. Oral fluid may be used for that, or small methyl cellulose paper strip can be used to collect the fluid from the gingival crevice. Nevertheless, the recent focus on the potential role of periodontal disease as a risk factor for cardiovascular and cerebrovascular diseases bring new importance to this aspect of salivary analysis. 10. Diagnosis of oral disease with relevance for systemic disease. Some systemic disease affect salivary gland directly or indirectly and may influence the quantity and the quality of saliva. These characteristic changes may contribute to the diagnosis and early detection of these disease. Qualitative changes in the salivary composition can also provide diagnostic information concerning oral problem. Increased level of albumin in whole saliva were detected in patients who received chemotherapy and subsequently developed stomatitis. Monitoring of salivary albumin can assist in the identification of stomatitis at a preclinical stage and enable the treatment for the stomatitis to be initiated at an early stage. Similarly, epidermal growth factor in saliva is decreased during the course of radiotherapy, and severity of mucositis related to reduced epidermal growth factor concentration in saliva. These systemic disease affect the salivary gland and saliva. Sjogren syndrome, rheumatoid disease, myasthenia gravis, cancer, cirrhosis, cystic fibrosis, HIV infection, hypertension, hormonal disorder, malnutrition, Parkinsonism, Alzheimer, renal disease, and sarcoidosis. These are all for our lecture. Thank you for listening.